Medicare Consulting. We are a free Medicare resource for you to assist anyone who is either Medicare eligible, approaching Medicare eligibility, or maybe you have a family member that's Medicare eligible that you're assisting. We are here to help you every step of the way. For today, we're going to learn about the 4 different parts of Medicare, some Medicare enrollment periods that you need to be aware of, some potential employee scenarios that you may encounter. We'll talk a little bit about our process, how we can help, and then we will open it up to any questions that anybody has. So Keely did a great job introducing us, but basically SGIA is a insurance broker that works in with only Medicare beneficiaries. So that's our expertise. And we are contracted in all 50 states with all major insurance carriers. So it doesn't matter where you live today or where you plan to retire in the future, you don't lose us if you move outside of the area because we can help you in all 50 states. So we're dive into different parts and pieces of Medicare. So when you become Medicare eligible, you will get this 125-page booklet in the mail called Medicare and You. And it's a little overwhelming. So what we're going to do today is break down the pieces to kind of help you wrap your mind around what's available and what the different parts mean. So you may or may not know there's 4 parts of Medicare. Medicare Part A, whenever you hear this, think of this as inpatient services, meaning you're spending the night in a facility. Could be primarily hospitalization, but skilled nursing and also hospice are under this category. Medicare Part A does not cost you anything per month. As long as you've worked in the United States for at least 10 years, you've already prepaid for it. So most people take Part A right away, but we'll go over some other scenarios where you might not want to. And then we have Medicare Part B as in boy. Part B covers all outpatient services like doctor's visits, labs, x-rays are more commonly used services where we're going in and coming out the same day, fall under the category of Part B. Part B does have a monthly premium attached to it. So you don't want to take Part B too soon because then you'll have to start paying for it. So you want to make sure you're in the right time to enroll in Part B. Then we have Medicare Part C, which is also known as a Medicare Advantage plan. And we have Part D, which is the prescription drug component of Medicare. So keep in mind that the only parts that you buy directly through Social Security are Part A and Part B. Everything else that we're going to go over today is sold through independent insurance companies. So if you're already a Medicare beneficiary, you'll probably notice that your mailbox is a little more full than normal. And that is because we are almost to the Medicare annual election period and all these different insurance carriers are trying to get your attention about their plan. So we're going to break it down into the different categories that you have to choose from. So we have original Medicare here, Part A and Part B, and then everything below here is through independent insurance companies. So you cannot buy a prescription drug plan with Medicare, you buy it through an insurance company. So we're going to talk about Medicare Advantages versus Medicare Supplement plans. These 2 categories that you have to choose from are very, very different from one another. So we're going to start with talking about what is a Medicare Advantage plan. Medicare Advantage plans have lots of different names. You may hear people refer to this as Part C, and you may hear this referred to as a Medicare replacement policy. And the reason we hear Medicare replacement is because what happens when you enroll in a Medicare Advantage plan, you sign what's called a statement of understanding, stating that you understand that by enrolling in an Advantage plan, you're giving up your right to file a claim to Medicare. So the Advantage plan will replace Medicare. You still have to enroll in Part A and Part B in order to buy an Advantage plan, but now all of your services are being handled by the insurance carrier that you pick. The biggest advantage to a Medicare Advantage plan is these plans start off at a $0 monthly premium, 0 deductible. Medicare Advantage plans also include additional services that original Medicare does not, such as prescription drug coverage. So you'll see this acronym MAPD. This means a Medicare Advantage plan with a prescription drug plan. So if you choose one of those plans, you do not have to pick up a separate prescription plan. They also cover things like dental, vision, hearing, and some of them even cover a gym membership. And these plans are going to be broken out into two main categories, HMO or PPO. PFFS is fee for service, and that's only available in really rural areas. So I'm not going to touch base on that. But if you're in one of those areas where that plan is offered, just please let me know if you want more information. But primarily, you're going to have an HMO or PPO plan to choose from. Just as a refresher, an HMO plan is the type of plan where you would elect your primary care doctor, and they would be the ones that would give you referrals to see a specialist. An HMO plan, you're also agreeing to stay within the insurance carrier's network of doctors, and you have in-network coverage only. A PPO plan is going to give you a larger network of doctors to choose from. It's going to allow you to self-refer to a specialist, and it allows you to go in or out of network. And that, in a nutshell, is a Medicare Advantage plan. And these plans are county specific. So if one of you lives in one county and your neighbor or friend, you guys are on a county line and they live in a different county, you guys have different Advantage plans to choose from. So now we're going to talk about the other category of plan that you can choose, which is a Medicare Supplement plan, also known. So like the name implies, in this scenario, it's not going to replace your Medicare Part A and Part B. It's going to supplement it. So therefore, Medicare A and B would be your primary insurance. So now you have access to Medicare's network of doctors, which is the largest network in the United States. It's about 93% of doctors, 100% of hospitals take Medicare. You have the freedom and flexibility to go anywhere you want and do pretty much whatever you want. So there's no limitations as far as what state you need to stay in. You also don't need to get referrals. Prior authorizations are rarely needed. So you have definitely more freedom and flexibility on this side. Plans are lettered A through N, with the most popular plan now really being Plan G. That's our meeting. So Plan G, for an example, you would have a one-time per year $240 deductible and then 100% coverage. So no copays, depending on what plan you pick. It sounds pretty good, right? Nationwide network of doctors, no copays. You can do whatever you want, whenever you want. What's the catch? So the catch with the Medicare supplement is these plans are not zero per month. They have an additional monthly premium that you would pay on top of your Medicare supplement, on top of your Part B premium. And they also do not include prescription drug coverage. So we'd also recommend, picking up a separate Part D prescription drug plan. How these plans work is Medicare is going to pay their percentage first, which for an outpatient claim is about 80%. And then the remaining 20% will be sent to whatever Medicare supplement plan you pick. And if you choose Plan G, it's going to pay that full 20% for you, leaving you nothing out of pocket after deductible. So basically, you've got two main choices. You can enroll in Medicare Part A and Part B, add on a Medigap plan, also known as Medicare Supplement, and a standalone prescription drug plan, or you can enroll in Medicare A and B and choose a Medicare Advantage plan that includes prescription drug coverage. Please keep in mind it's this or that. You would never want both a Medicare Advantage or a Medicare Supplement plan. They do not work together, and it would just cause all your claims to be denied. So it's either or, never both. So now we're going to take some time and dive a little deeper into Original Medicare. Original Medicare, again, is we're talking Part A and Part B. So first we'll talk about enrollment periods. So when you're first eligible for Medicare is when you turn 65. So you have what's called your initial election period, which is 3 months before your 65th birth month, the month you turn 65, and 3 months after your birth month is your first opportunity to enroll in Medicare Part A and or Part B. Enrollment in Medicare is not automatic. A lot of people think they're automatically enrolled in Medicare. That is only true if you're already drawing Social Security retirement benefits. If you're not receiving your Social Security check, you actually need to go online and apply for Medicare. If you choose not to enroll in Medicare during your initial election period, your next opportunity will be most likely a special election period, which happens anytime you want to come off the group health plan. So you can leave your group health plan at any time and then pick up any parts of Medicare that you want. We are just a few days away from the Medicare annual election period, and you can probably hear I'm already starting to lose my voice a little bit because this is our busiest time of year. So this is your opportunity to make a change to your current plan. So if you're not enrolled already in a Medicare Advantage plan or a Medicare supplement plan, you do not have to do anything. So if you're on your employer plan, you can ignore all that mail that's coming through your mailbox. You don't have to make a change during this window of time. There's the Part A premium. We talked about that. If you work 10 years in the United States, you've already prepaid for it. The Part B premium is income related. So it's based on your modified adjusted gross income that was reported on your 2022 tax return. So if you made less than $103,000 as an individual or $206,000 if you file with a spouse, your Medicare Part B premium will be $174.70 per month. This out-of-pocket expense, this just shows if you chose Medicare A and B and you did not add on an Advantage plan or a supplement plan. So we don't recommend you ever doing this because you have a lot of out-of-pocket exposure. First of all, you would have a $1,632 deductible each time you're hospitalized. And if you stay more than 60 days, you start incurring a per day copay of $408. And then on all your outpatient services, you'd have a $240 deductible, which really isn't too bad. But the concerning part is you're on the hook for 20% of whatever the doctor charges with no out-of-pocket maximum. So 20% of question mark is never a good idea. So we recommend you either stay on your employer plan, put in a Medicare Advantage plan, or a Medicare supplement plan to protect yourself from having to pay those out-of-pocket expenses. That was a lot of information, so let's just do a quick review. The Medicare Advantage plans, those are the ones that are HMO or PPO. These are the plans that replace Medicare A and B. Start off at a $0 premium, 0 deductible, include prescription drug coverage, dental, vision, hearing, sometimes a gym membership, lots of additional benefits that original Medicare does not. Medicare supplement plans, these are the ones that give you access to any doctor that accepts Medicare anywhere in the United States. Medicare is going to pay their portion first, and the supplement is going to pick up the remaining amounts. And depending on what plan you choose, they can pick up the full remaining amount. Monthly premiums go on top of your Part B premium. And the cost of a supplement is based on how old you are, where you live, and if you use tobacco products or not. Prescription drug coverage is not included, so we always recommend putting in place a standard or separate Part D prescription drug plan. So for the last 18 years, this is how Part D has worked. There's been these stages that you go into based on the cost of your medication. There's been this awful thing called the donut hole, where if you go into that, you have to pay 25% of your medications up into $8,000. Very confusing and can be very expensive. The good news is because of the Inflation Reduction Act, this is changing for the first time ever. And starting in January of 2025, the coverage gap or donut hole is gone. So we're very happy about that. We no longer have the donut hole. So what we do have are some plans have a deductible. Their deductible is $590. And then what we have is a $2,000 out-of-pocket maximum. So your worst case scenario is up to $2,000 out of pocket. But what's great is that $2,000 is not just what you're spending. The drug manufacturer is helping you get to that point too. So your cost is actually less than that. And then once you get to that maximum, then your co-pays for prescriptions for the rest of the year are zero. So then all of your medications are covered at 100%. We're really, really excited about this new change. This is a huge improvement to prescription drug plans. And it doesn't matter if you choose a Medicare Advantage plan or a standalone prescription drug plan. This applies to all of them in every state. So the next thing you're going to see here is the two plans that you have here with your employer, and then all compared side by side to a Medicare Advantage plan and a Medicare Supplement Plan G with prescription drug coverage. So I just wanted you guys to take a look at this. There's definitely some premium savings out there, especially if you're covering a spouse. So you can see your spousal rate is over $400 a month. As opposed to going on to an Advantage plan, we can decrease that to about $175 a month. Or for close to or potentially less than that, you can go with a Medicare Supplement Plan G, bringing your out-of-pocket maximum down to $240 a year. So there's definitely some significant savings out there, not only in premium, but in out-of-pocket maximum. So I just wanted to share this with you because there's a common misconception that Medicare is not as good as a group health plan. And that's certainly not true. It just depends on what plan you choose and if you're choosing the correct plan for you. So now we'll just run through some potential employee scenarios. So what do you do? So employee scenario number one, we have an employee who's turning 65 and not planning on retiring. So in this scenario, you want to stay on your employer plan. We would recommend that you enroll in Medicare Part A only. The only time you wouldn't enroll in Part A is if you're on an HSA plan, which your employer does not offer. So if you called our office and said you were staying on the employer plan, we would advise you to take Part A only. It doesn't cost you anything, and it becomes your secondary insurance to your group health plan. You wouldn't need any other parts of Medicare because in this scenario, you're staying on your employer plan. Remember, application is done online through Social Security's website. Here's the website. So you can go online and apply directly for Medicare Part A whenever you want. Employee scenario number two, we have someone who's turning 65. You're not planning on retiring, but you want to come off the group health plan. You want to decrease your out-of-pocket maximum, or you want to decrease your spouse rate. What you'll need to do is enroll in both Medicare Part A and Part B. Applications done online. Reach out to SGIA for assistance, and we can help you figure out, based on your doctors, your medications, what the recommendation is. We'll help you pinpoint, should you go Advantage versus should you go Supplement, and show you the different cost comparisons between the two. And then you, of course, want to let Keely know, or someone in Human Resources, that you want to be taken off the employer plan. In our next employee scenario, we have someone who is post 65 and you're retiring. So in this scenario, you're going to want both Medicare Part A and Part B, because it doesn't matter if you choose an Advantage plan or a supplement plan, you need both Part A and Part B. There is a special form that your employer will need to fill out for you, showing you were on employer coverage and you're using your special enrollment period. The Medicare Part B and Part D penalties do not apply as long as, since you've turned 65, you've been covered by a large group health plan. You don't have to worry about any sort of penalty as long as you've always been covered by an employer that has at least 20 employees. Then, of course, you can reach out to us and we help you figure out what plan you should go with. There's a couple other steps there, like calling Medicare Coordination of Benefits. These are things that we can do for you. And our last employee scenario is we have an employee who is on COBRA and becomes Medicare eligible. So Medicare and COBRA do not work well together at all. So the rule is you have to have Medicare Part B by the 8th month of COBRA. Otherwise, you will have a Part B penalty for the rest of your life. And then in this scenario, you're paying your Part B premium plus COBRA. And 9 out of 10 times, that is more expensive than just paying Part B and picking up your own supplement or Advantage plan. So what we'll do is we'll help you compare and contrast that cost. And then if you determine you don't want COBRA, which is highly recommended, then we will help you collect that special form from your employer and complete the application for Medicare Part B. If you have a spouse who is not Medicare eligible, they can get up to 36 months of COBRA, and that starts counting from the month you turn 65. So if you retire at 66, then they don't get 36 months, they get 36 minus 12. So we understand that Medicare can be very confusing and a little overwhelming. So here are some resources that are available to you. Number one is you can contact Medicare directly at 1-800-Medicare, and they can answer general questions for you regarding Medicare. You can go online to medicare.gov, which is a fantastic resource. We use it every single day. It's totally safe to use. You can put in your zip code and see all the different plans available in your area. You can contact a carrier of your choice. Problem doing that is they can only talk to you about their plans. They can't compare and contrast different companies for you. Or you can work with an independent agent that represents many different plans, and that way you can see differences. We are your resource, of course, and your agent that you have access to. None of our services cost anything. They're all completely free. And we are contracted with all major insurance carriers in all 50 states. So here is just kind of a snapshot of some of the main companies that we work with. So when you call into our office, we can help compare and contrast the multiple carriers and the multiple plans to help kind of point you in the right direction. A little bit about our process. We're huge on education. Just like this informational meeting you attended today, we want to make sure you understand Medicare. If you call our office and say, I don't get Medicare, we will literally walk you through it, make sure you understand. Because 6 months from now, you may totally forget everything that we talked about today. So we want to make sure you understand how Medicare works, so you understand what you're enrolling in and that you're picking the right plan for you. Then we'll do a full needs assessment. So we'll get down into the weeds of who are your doctors, what are your medications, do you have a pharmacy you like, and do you need your plan to work outside of your home county? Do you need it to work outside of your home state? And then what we'll do is we'll take the 40 some odd plans that are available to you, and we'll narrow it down to about 2 or 3 that we recommend specifically for you. All you have to do is figure out which one you like, tell us, and we do all the paperwork for you. So we'll pre-fill in that 10-page application, make sure it gets processed correctly by the insurance carrier, and then make sure you have your ID card in hand by the effective date. And then by working with us, we become your insurance brokers. That means anytime throughout the year, if you have questions or issues, you can call us directly. You don't have to call the insurance company and wait on hold. You'll be able to contact your assigned benefits consultant here at SGIA, and they can help you throughout the year. Basically, we do all of these steps for you to help figure out what is the right fit. This is a totally customizable decision. This is going to be probably the first time in your life you ever got to make your own choice. Because when you were a kid, your parents chose your insurance. And when you entered the workforce, your employer chose your insurance. And now you're 65, Medicare eligible, and for the first time, you get to make the decision what is right for you. And that can be a little overwhelming, so we're here to help. Here you'll see our toll-free number. Please feel free to write this down. You can speak to any benefits consultant in our office. They are familiar with your plan at work. They can help you do a side-by-side comparison and answer any questions you have. We'll open it up for questions in just a moment, but I do want to make a note that if you do have a question that is more sensitive, that you don't want to ask in front of a group setting, feel free to call my direct number, which is 480-270-8160, or you can call our toll-free number and have a more private conversation with a benefits consultant.